Hello everyone, today we'll be discussing the management of status epilepticus. Status epilepticus is a life-threatening condition that is associated with at least 5 minutes of continuous seizures or repeated seizures without regaining consciousness between episodes. It's a medical emergency with significant morbidity and mortality. The most common causes of status epilepticus are previous seizures, stroke, trauma, metabolic disorders, and central nervous system tumors. So we'll look at this treatment algorithm that's used for status epilepticus. So once a patient starts seizing, that's going to be you look at the first 0 to 5 minutes are used for stabilization. So what does that mean? When you stabilize the patient, you assess the airway, breathing, the circulation, time the seizure onset, monitor vital signs, correct an ECG if possible, check how the BP is, the heart rate, the temperature, collect blood glucose, and if blood glucose is noted to be less than 60 milligrams per deciliter, administer 50 ml of 50% dextrose IV. That's because hypoglycemia can also lead to seizures. Then collect blood for lab investigations like electrolyte profile, CBC, liver, and renal function tests. So this is usually done within the first 5 minutes. Remember we said status epilepticus is if seizures proceed to longer than 5 minutes. So if the seizure does not continue, you do your routine medical care. If seizure continues, you start your first-line therapy, which is usually between 5 to 15 minutes. Is the phase of first-line therapy. So you can give IV diazepam, which is at 0.15 to 0.2 milligrams per kg per dose, with a maximum of 10 milligrams. Or you can give IV lorazepam, 0.1 milligrams per kg. That's the maximum dose, okay? So if you notice the seizures have continued in the next 5 to 10 minutes, you can repeat the above dosage for either diazepam or lorazepam. If seizures don't continue after, you give your routine medical care. However, if you notice despite giving 2 doses of diazepam or lorazepam, the seizure still continues, you switch to second-line therapy. So second-line therapy consists of you can give valproic acid, phenytoin, or phenobarbital. So valproic acid, you can give it at 30 milligrams per kg as a loading dose, and then 4 to 8 milligrams per kg every 8 hours as a maintenance dose. Or you can give phenytoin 20 milligrams per kg as a loading dose and 1.5 milligrams per kg for every 8 hours as maintenance. Or alternatively, you can give phenobarbital at 20 milligrams per kg as a loading dose. Then after that, if you notice the seizure has subsided, you give your routine medical care. However, if you notice the seizure has still continued, which is 15 to 30 minutes have already passed, you move to your third line therapy. So under third line therapy, you have your ketamine, which you can give as 1 to 2 milligrams per kg bolus, and then 1 to 2 milligrams per kg per hour continuous infusion for a minimum of 24 hours. So you have noticed this will also help sedate the patient. Propofol 1 to 3 milligrams per kg bolus and 5 to 10 milligrams per kg per hour continuous infusion for 24 hours. Then thiopental can also be an option, which can be given at 3 to 5 milligrams per kg bolus and 3 milligrams per kg per hour continuous infusion for 24 hours. So that's all about treatment algorithm for status epilepticus. This is basically the same slide explained in a different format. So that's all about management of status epilepticus. Thank you.